Hello dear students, welcome you all to the Master Nursing classes. Myself Mr. Nagraj, your NORCET mentor and guide here in front of you all today to discuss the very important sessions for the Nimhans examination. Here students, I am conducting the 8 days crash course sessions for your Nimhans examination and entire psychiatric, entire mental health nursing subject I am covering here. So if you are watching the 8 days session completely means you will be having very easily you will be getting around 20 questions from the psychiatry. You will be cracking those questions with very clear concept. Here I am focusing to clear the concept in the very short duration rather than the questions. Students, please do ask the questions and answer session completely, and if you have any doubt, please comment in the comment box. I will definitely respond to your comments. Okay, and very importantly, all of you need to do only one simple thing is you have to take one notebook with pen, okay, and sit in front of your computer or else your mobile. Okay, do watch the video completely and note the important points what I'm trying to explain you very importantly, and revise those points twice before going to your exam, because this is the basic very importantly you have to know. And in this today's session I am covering very important topics, that is the history of the Nimhans and history that how the mental health nursing established, and among those only important points I have considered for you. Okay, and very basic terminologies and very important terminologies I am included in these sessions. Okay, we will discuss each and every points in detail. If you have any doubts in between means, do comment in the comment box. I will definitely respond for your comments. Okay, so without wasting time, we will start the session, students. Okay, so our first questions comes like this: Nimhans started in the year of. Students, all of you giving the Nimhans examination, you have to know the history of the Nimhans, because one question is going to come from the this sessions. Okay, so Nimhans is started in the year of. Yes, any one of you know Nimhans is started in the year of. Yes, Nimhans started in the year of 1974, 27 December 1974. So before this, Nimhans by the name they have used to call the government mental hospital Bangalore. So very importantly, in the year of the 1974, they converted it as a National Institute of Mental Health and Neuroscience Bangalore. The only one international mental health system is there in our India, that is there in the Bangalore, the Silicon City of the India, that is the Bangalore. So there our Nimhans is located. Okay, so I think all of you are going to Bangalore to give exams for the Nimhans also. So this is the year when the Nimhans established. That is in the year of the 1974, 1974. Okay, 27 December 1974 is the exact answer where you to put in the the answer box. Okay, option B is there, students. 1912. In the year of the 1912, Indian Lunatic Act started in the year of 1912. So this is modified as Indian Mental Health Act. Okay, Mental Health Act started in the year of very importantly 1987, and now this is updated as very importantly Mental Health Care Bill. Okay, Mental Health Care Bill. Okay, MLCB, Mental Health Care Bills. Now the updated one is the newer one, the newest version of the the rules regulations what the mental health nursing institutes or mental health institutes are following is that is our mental health care bill, that is modified and established in the year of the 2013. So students, now we are not following the mental health act also, we are not following the Indian Lunatic Act also. In the Indian Lunatic Act, it started in the year of 1912, and which is converted into the Indian Mental Health Act, and now this is modified into the Mental Health Care Bill. All of you know that is the Mental Health Care Bill. I am discussing very important points where those updates which came in the Mental Health Care Bill. Very important update is that, students. So where we were studying the electroconvulsive therapy. So we have studied the very importantly. Previously they used to give the electroconvulsive therapy without muscle relaxant, without anesthesia. According to the Mental Health Care Bill 2013, without anesthesia, without muscle relaxant, giving the electroconvulsive therapy is it's a punishable offense. Okay, they are not giving the without anesthesia, without muscle relaxants, giving the electroconvulsive therapy is the punishable offense. So this is the new update came in the Mental Health Care Bill, and Electroconvulsive therapy is not given in the minors. Very importantly, those are less than 18 years. Okay, so less than 18 years, ECT is contraindicated according to mental health care bill, and according to mental health care bill, yes, giving the ECT without is anesthesia and without muscle relaxant is punishable offense. Very importantly, you have to know the new updates from here. Okay, very importantly, so what all are the changes which occurred in the Indian Lunatic Act 1912 and Mental Health Act, very importantly 1987, and Mental Health Care Bill 2013. Students, this is the updates. There is highest chance of asking the question from this slide, this board session. Very importantly, please don't note this one. Okay, previously in the Indian Lunatic Act, we used to call the psychiatric patient as in lunatic. Okay, psychiatric patient, what we used to call previously, we used to call the lunatic. And the hospitals which are made for the, or the staying area which are made for the lunatics are the lunatic asylums. Okay, the hospitals, psychiatric hospitals previously used to call the lunatic asylums. Means asylum means the jail. Okay, so and in the Lunatic Act, uh, if the person mental disability, if he did any criminal things, means we used to call them as a criminal lunatics. Okay, and the medical practitioner who is treating the psychiatric patients or the mental illness patient, so that doctor we used to call as the psychiatrist. But in the Mental Health Act, the lunatic is converted into, the psychiatric patient is converted into a mentally ill person. Very important. These are the old word. These are the outdated words, and these are the new words. Okay. Very importantly, new words we are now currently using. Okay. So lunatic, the psychiatric patient we call, according to Mental Health Act, we call them as an, yes, the mentally ill person. Okay. Lunatic asylums you used to call the psychiatric hospitals. Okay, the psychiatric hospitals. And criminal lunatic means the person who did the, yes, the criminal offense and he is mentally ill, so that person you used to call mentally ill prisoner. Okay, mentally ill prisoner, very importantly. And the unchanged word from the Indian Lunatic Act to Mental Health Act is the, yes, that is the only one word is unchanged, that is the psychiatrist. Psychiatrist word is unchanged. It remains same in the Indian Lunatic Act also, and which is remains same in the Mental Health Act also. How the question examiner may arise here? The examiner may arise here. The unchanged word from the Indian Lunatic Act to the Mental Health Act is the only one word, that is psychiatric. Rest all words are changed to Indian Lunatic Act to the Mental Health Act. Okay. So currently in the Mental Health Act, previously we are using these words. Okay. Mentally ill person, not a lunatic person. Psychiatric hospital, not a lunatic asylums. Okay, mentally ill prisoner, not in criminal lunatic. Okay, these are the new words we are using, and these are the old words we are not using. Very important updates. Keep note in your exam notebook, in the very important your last minute revision notebook. Okay, so these similar words we are using in the, yes, we are using in the, these similar words in the Mental Health Care Bill also, that is updated in the 2013. Okay, that is updated in the 2013. These words, new words are remaining unchanged in the Mental Health Care Bill also, very importantly. Okay, so yes, let me go for the next question. I hope your new updates and concept is clear here for the mental health nursing. Okay, this is our next question. Yes, read the question carefully and try to answer for the question. Founder of the cognitive development theory. Yes, who is the founder of cognitive development theory? Who is the founder of the cognitive developmental theory? Yes, option A comes like this: B.F. Skinner. Option B is the Ivan Pavlov. Option C is the Emil Kraepelin. Option D is the Ivan Bleuler. We will discuss in these best personalities which all are given the best contribution to our psychiatric nursing. Okay, so first try to answer for the question. This question: who is the founder of the cognitive developmental theory? Yes. Yes, option E is like this. What is the option E? None of the above. Yes, try to answer, students. Here, B.F. Skinner given the operant conditioning theory. Operant conditioning theory. Okay. So we are eliminating the option A. And Ivan Pavlov given the, yes, classical conditioning theory. Ivan Pavlov given the classical conditioning theory where he is used the bell and dog for the his yes the experiment. Okay, and Emil Kraepelin is the person who called the schizophrenia as a dementia precox. So here I will clear one concept again here, students. This concept I have discussed in the last session also. So shortly I want to discuss here also because this is very important. So previously what happens in the very early years, the dementia was diagnosed and established disease. Okay, so and the sign symptoms of the dementia usually used to come in the older age persons. Okay, the sign symptoms of the dementia usually used to found in the older age persons, but those sign symptoms when started to appear in the young age persons. Okay, the dementia like sign symptoms which have started to appear in the young age persons, that time Emil Kraepelin did, yes, he called, that is then dementia in the early onset. That is what he called the, yes, dementia precox. What is the dementia precox? He called the sign symptoms of the dementia which early occurring in the youngest peoples. He called that is a dementia precox, but actually that is not a dementia precox. So dementia precox in the next in the year of the 19, yes, very importantly 1912, when the our Lunatic Act established at the same time only, Eugen Bleuler called that dementia precox as in schizophrenia, and Eugen Bleuler is the founder of the word schizophrenia. Okay, very importantly, and schizophrenia usually previously used to call as the dementia precox by the Emil Kraepelin. Okay, okay, this is the our question session, but the answer for the question is still, yes, still not completed. Who is the founder of the cognitive developmental theory? Students, founder of the cognitive developmental theory is Jean Piaget. Okay, Jean Piaget is the very importantly founder of the cognitive developmental theory, and here the answer goes to option E. That is the none of the above. Okay, none of the above. So I have told five very important questions here in these sessions. First one is the who is the founder of the B.F. Skinner? Who is the founder of the operant conditioning? That is the B.F. Skinner. Who is the founder of the classical conditioning theory? He is the Ivan Pavlov. And who is the founder of the dementia precox? And who called schizophrenia as a dementia precox? So he is the Emil Kraepelin. Very importantly, that is asked in our last two NORCET exams. And uh, then who is the pioneer who coined the word schizophrenia? That is the Eugen Bleuler in the year of the 1912. He coined the word schizophrenia. Schizophrenia means schizo means the split, phrenia means the mind. Okay, schizophrenia means the split mind. If he discovered the word, Eugen Bleuler is the discovered the word schizophrenia. Very important. And the founder of the cognitive developmental theory is the Jean Piaget is the founder of the cognitive developmental theory. Okay, option goes here the none of the above. Very importantly. I hope your concept is clear here. Okay. Yes, let me go for the next question. Here is your next question. Psychosocial developmental theory is given by. Very importantly, students, in the above these two discussed questions, definitely one questions will come from the those concept. Nearly 10 questions I have told there in the two questions. Okay. Very importantly, definitely two will come in your exam. Okay, definitely two will come in your exam. So next question is like this. Read the question carefully and try to answer for the answer. Psychosocial developmental theory is given by. Who is the founder? Who is the pioneer who discovered the psychosocial developmental theory? Don't do gutbud here. Just read the question carefully and read the options carefully. Yes, students, I am not asking about the psychosexual. Psychosexual means if the examiner is asking psychosexual developmental theory, that is given by the Sigmund Freud. Okay, that is given by the Sigmund Freud. Okay, and psychosocial developmental theory is given by the Erik Erikson. He given the 8 stages of the, yes, 8 stages of the psychosexual developmental theory. Okay, where we will study the trust versus mistrust and all. So we will discuss this theory in the next session. Very important theories. I will discuss all 8 stages because one question will comes definitely from the Erik Erikson 8 stages of the psychosocial development, and the Sigmund Freud is the person who discovered the, yes, psychosexual theory. Very importantly, and psychosocial theory is discovered by the Erik Erikson. So how many stages are there in the Eric Erikson psychosocial developmental theory? There are 8 stages are there in the Eric Erikson psychosocial developmental theory. So answer for the question goes to option E, Eric Erikson. And what is the contribution of the Hildegard Paplu for the psychiatric nursing? Hildegard Paplu is also called as the mother of psychiatric nursing. Mother of psychiatric nursing is our Hildegard Paplu. And very importantly, who is the founder of the interpersonal relationship? Students, you are, I think you know IPR theory, that is the interpersonal relationship theory. Interpersonal relationship theory is discovered by the our very important Hildegard Paplu. Okay, Hildegard Paplu, who is also called as mother of the psychiatric nursing, and she is the founder of the interpersonal relationship theory. Okay, what is the who is the Linda Richard? Linda Richard is the yes, the respected first psychiatric nurse is the Linda Richard. Okay, first psychiatric nurse is our Linda Richard. First psychiatric nurse is Linda Richard, and IPR theory is discovered by the our Hildegard Paplu. Mother of the psychiatric nursing is the Hildegard Paplu. Sigmund Freud discovered the psychosexual developmental theory, and psychosocial developmental theory is discovered by the Eric Erikson. So answer for this question goes to option E, Eric Erikson. Very importantly, okay. So I hope the concept is very much clear for you all. Let me go for the next question. Here is the next question for you. One more question that is related to the history of the Nimhans. Who is the current director of the Nimhans Bangalore National Institute of Mental Health and Neuroscience? The examiner may ask the full form of the Nimhans also for you. That is the National Institute of Mental Health and Neuroscience Bangalore. Okay, which is situated in the Silicon City, Bangalore. Is the capital of the Karnataka. Okay, so here is the who is the current director of the Nimhans Bangalore? Option A comes to Dr. Pratima Murthy. Okay. Option B is Dr. M. Srinivas. Option C is S. Sri Mansukh L. Mandviya. Option D is Nirmala Sitaraman. Students, I think all of you know these two personalities. Okay. These two personalities, option C and option D, belongs to the politics. Nirmala Sitaraman is the Minister of the Finance. Okay. Central Minister of the Finance. Okay. And Sri Mansukh Mandviya is the our central health minister of the central government, who is the Sri Mansukh L. Mandviya is the health minister, and Nirmala Sitaraman is the financial minister in the central. Okay, and Dr. M. Srinivas is the our AIMS Delhi director. Okay, who is the AIMS Delhi director? Director of AIMS Delhi is the Dr. M. Srinivas. He is from the Karnataka. Okay. So, and option A is the Dr. Pratima Murthy is the our current and best director of the Nimhans Nimhans Bangalore Institute. Okay. Who is the current director of the Nimhans is the Dr. Pratima Murthy. Okay. I think your question is clear here. Okay. So, let me move for the next question. So, here is your next question. Main important difference between the psychotic and neurotic disorders. What is the main important disorder where we classify this is an neurotic patient and this is a psychotic patient? Option is based on the physical appearance. Option B is based on the insight, and option C is based on the anxiety, and yes, the option D is based on the family history. Students, in both psychiatric patient and neurotic patient, there is family history is there, so we can't differentiate based on this one. This is a psychotic, this is a neurotic. And in both psychotic and neurotic patients, the anxiety is the common feature. Okay, most common psychiatric clinical manifestation is the most common psychiatric clinical manifestation is the anxiety. Students, okay, we will discuss all those anxiety related disorders. That is the phobic anxiety, panic anxiety. Okay, very importantly, we will discuss all those things in the next sessions. Okay, and option B is the insight. Students, what is the insight? Insight is the simple word that stands here. Person, the mentally ill person, if he is knowing the disease condition is there for him, means if he is having the self awareness of the his own disease condition, means he is having the intact insight, means the insight is present, means the person is aware about his own disease condition. That is the insight. If insight is present, means we call that is a neurotic disorder. Okay, this is not psychiatric disorder, it's a neurotic disorder. But in the psychiatric disorder, Intact is absent, student. Insight is absent. The person is not knowing that he is having the major psychiatric disorder, or else he is having the hallucinatory symptoms, illusion symptoms, delusion symptoms. Okay, if he is unaware of the his own illness is known as lack of insight or the loss of insight. So if the patient is having the loss of insight, we call that is an psychiatric disorders. Okay, the main difference between the psychotic and neurotic disorders is the insight and insight. The physical appearance in both, yes, neurotic and psychiatric patients are the disturbed. Okay, disturbed physical appearances there already. Okay, very importantly. So the main important differentiating feature of the psychotic neurotic disorder is the insight. Insight is present means he is the neurotic patient, and lack of insight leads to the, yes, very importantly, psychiatric patients. So insight was the very important. What is the insight? Insight is the self-awareness of his own disease is called as the insight. Okay, very important. Yes, here is the next question. Close your eyes, take deep breath, and read the question carefully and answer for the questions. Yes, read the question carefully, students, and try to answer for the question. I'm waiting for the answers here. Yes, the question is like this: coexistence of two opening opposing feelings for or emotion in same thing at the same time. Yes, let me read the question again. Coexistence of the two opposing feelings or emotions in the same thing at the same time. Students, what happening here? Here is the patient. Okay, here is the patient. Okay, he is watching at one flower. Consider he is watching at one flower. So that flower is very beautiful. That flower is very beautiful. He is thinking he want to take the flower to his own, but he is also thinking if he divides the flower from that flower tree, that flower is going to be waste in the next day. So you want to take the flower also, and he is thinking the flower will be going to waste in the next day. So because he is having the two coexisting opposite feelings towards one object. For this subject, he want to take also and he want to leave also. So at the same time, at the same thing, he is having the two opposing feelings. Means that is what we call, yes, that is what we call, very importantly. Option C is the artistic thinking. Oh, students, it's not an artistic thinking. Okay, very importantly, it's not an artistic thinking. I will explain what is artistic thinking. And option B is the affect disturbance. It's not an affect disturbance. I will explain the affect disturbance. Okay. Option C is the ambivalence. What is the ambivalence? Ambivalence is the condition where the person is having coexistence of the two opposite feelings or emotions in the same thing at the same time. We call that is a, yes, the ambivalence. Very important. 5-star question for your exams. Okay. 5-star question for your exams. So, and what is the associative looseness? This is not an associative looseness. Associative looseness is the thought flow disorder where the person is not following the sequence in the sentence. Okay, that is what we call the associative looseness. Means he is not maintaining the association and there is no any logical relationship between the words what the patient is telling. That is what we call the associative looseness. Let me give example for the associative looseness. Okay, so the person is telling like this: I have booked one cafe for my birthday celebration and I have went my home and I came to bus by flight and I am in Bangalore and in Chennai. Okay, and bye. Okay. In this sentence, what I told, there is no any logical relations. There is no any sequence in the sentence. If there is no any logical relations, if there is no any sequential sequence in the sentence, we call that is a loss in the association. So that is what we call the associative looseness. Students, very important. Okay, and option B is the ambivalence. Ambivalence is, we have option C is the ambivalence. We have discussed the ambivalence when the person is having the coexisting and two opposite feelings, and emotion in the one thing in the same time. Okay, in the same thing we call that is an ambivalence. Okay, and we are having the affective disturbance. What happens in the affective disturbance, students? See, when we went one home where the sadness is occupied at that home, where that in that home we are, yes, we are laughing like anything. Okay, that is an inappropriate affect. Okay, means affect is the short term response to the thing. That may be happier response. Okay, that may be happier response or that may be a sad response. Okay, If you are giving the happier response at the happier state and sad response at the sad state, means that is an appropriate affect, that is a mentally healthy person. But the person who is laughing at the home where the sadness is occupied, and who is crying at the home where the happier is occupied. So he is giving the inappropriate expressions. Means his affect, his response, his emotional response is not appropriate. That is what we call the affect disturbances. And if the person is not giving any response, means he is not crying also, he is not laughing also. That is what we call the blunt affect or the flat affect. What is the blunt affect and flat affect? When there is no any response to the external stimuli, that is what we call the blunt affect, or that is what we call the flat affect. And when the person is laughing at the sad area, and when the person is the sad in the happier area, we call that is an inappropriate effect. Okay, the appropriate effect is the effect where the mentally healthy person is having, like we both are having. Okay, you are happier when the happier state, and you are sad at the sad state, means your effect is very normal. Okay, so this is what we call the affective disturbance. And what is the artistic thinking? Artistic thinking, here the patient or here the client is completely, yes, completely detached from the reality. He is not associated with the reality. Okay, he is not maintaining any association with the reality, and he is not maintaining reality with the environment also. He is not maintaining the reality with the self also, and he is not maintaining the relativity or the uh, what we call feeling with the self also. Self is, he is not maintaining the relativity for environment also, for others also he is not maintaining the relativity. He is completely derelated from the situations. We call that is an artistic thinking. Okay, very importantly students, this is what these four A's. Okay, we are having the option A is the artistic thinking, first word is the A, and option B is the affective disturbance, first word is A, and option C is the ambivalence, first word is A, and option D is the associative looseness, first word is A. These four A's are the, yes, Eugen-Bleuler's four A's. Okay, we call that is an Eugen-Bleuler's four A's of schizophrenia. Okay, so one more classical questions that may come for your exams. The what all are the Eugen-Bleuler four A's for the schizophrenia? That is artistic thinking, affective disturbance, ambivalence, and very important associative looseness. Yes, the examiner will give three options from here, and one more option he will change as an, yes, that option also I am going to tell. He will put the word anhedonia. Okay, he will put the word anhedonia. Anhedonia is the not a part of the Eugen-Bleuler's 4A. Okay, wherever the word, if the examiner is asking Eugen-Bleuler's 4A and in the option he is giving the anhedonia, means first eliminate this option anhedonia. Okay, that is where your question is going to correct in the exam. Please read the questions carefully in the exam and try to answer for the question. Whatever the thing you are knowing is that not going to matter for the examiner. Whatever the examiner is asking for you, that is going to matter, and that is going to decide your rank, students. Very importantly, please be concentrated for your question and options, very importantly. Okay, so let me go for the next question. Yes, read the questions carefully and try to answer for the questions here. Okay, read the question carefully. Okay, try to answer for the question. What is the inability to experience the pleasure in activities? Yes, students, come on. This is going to be a golden class for you all. There is around 6 to 7 questions will come from this single particular video if you are watching this video, and if you are making notes of this video, and very importantly, if you are making notes and revising that twice, means you will going to correct the 6 to 7 questions from this one particular video. Okay, so try to understand the concept rather than the questions. Yes, read the questions carefully, then go for the options. Yes, what is the questions and what is the options here? Yes, let me read the questions. Inability to experience the pleasure in activities. Patient previously, whatever the activities he is doing, he used to experience the pleasure there. He used to happier for the activity what he done. But now he is unable to experience the pleasure. He is unable to experience the happiness in activities whatever he is doing. Means what we call that is, yes, that is what we call, very importantly, option A is the stupor. We will not call this in stupor. Okay, I will explain what is stupor. Okay, and option B is the anhedonia. So when the person is unable to experience the pleasure, and one person who is unable to experience the happiness in the activities whatever he is doing, so that is what we call the anhedonia. So answer for this question goes to anhedonia. Okay, and what is the catalepsy and cataplexy? Very two important words that confuses you. in the exams. Let me clear your concept here. Okay, let me clear your concept here. What is the stupor and what is the catalepsy? What is the cataplexy? Anhedonia we have studied here, students. Anhedonia is the, yes, inability to experience the pleasure in the activities. That is what we call the anhedonia. What is the stupor? In the stupor, very important. Person is akinetic. He will not move anywhere. Okay, person is akinetic, and very importantly, in the stupor, person is akinetic and person is mute. He will not say anything. Person is mute. He is not move anywhere. He will not say anything. And but he is, yes, but he is knowing. He is aware of his surroundings. He is aware of his surroundings. That is what you call, yes. That is what you call stupor. What is the stupor, students? Stupor is a condition where the person is not movable, means his motor activities are retarded, and he is unable to talk, means his verbal activities also retarded, but he is knowing, he is having the intact of his awareness of the surroundings. That is what we call the stupor. Very important criteria: person should be akinetic, person should be mute, and he should have the connectivity with the reality, and he should know the whatever the thing going around surround him. That is what we call the stupor word, very importantly. So this is the criteria to tell the patient is in the state of the stupor. That is, the patient is akinetic, patient is mute, and he is aware of his surroundings. We call that is a stupor and stupor. Okay, so anhedonia is the inability to experience the pleasure. What is the catalepsy and cataplex? Yes, answer the students. Anyone knowing? Yes, do comment in the comment box if anyone is knowing. I'm waiting for your comments. Yes, students, come on, please. Think. Yes. Students, what is the cataplexy? Cataplexy is the state where when there is an unexpected sudden emotion hits to the mind of the person at that point of the time, loss of muscle tone, sudden and loss of muscle tone, we call that is an cataplexy. Okay, due to the sudden emotional responses, due to sudden emotional responses. That is what we call catalepsy. And what is the cata? What? Sorry, that is what we call cataplexy. Cataplexy is the loss of muscle tone due to sudden emotional response. We call the as the cataplexy, and catalepsy is the thing where, yes. Come on, answer. Come on, answer for the question. What is the catalepsy? Yes, comment in the comment box. You will comment or else I will tell here. Yes, tell me in the comments, please. What is the catalepsy? Yes, do comment in the comment box. Otherwise, watch the comment box after completing the video. I will be putting the answer at the last. Okay. Yes, the next question is like this. What is the fear of the darkness? What is the fear of the darkness? So here in this questions, I am discussing the around 20 questions for you all the phobias I am going to tell here. Okay. So first we will discuss what is the phobia, and then after we will go for the types of the phobia. Okay. So look at me. If you are seeing something which is dangerous, something which is harmful, means you are fearing, that is okay, that is the normal, that is the good mental sign. But you are simply fearing for everything, you are simply having the anxiety in you for everything, that is not going to hamper your any mental activity, and that is not going to be damage you for you. So at that point of the time, irrationally, simply without any meaning, you are fearing, means that is what we call the phobia. What is the phobia? Irrational fear to the simple objects, that is what we call the phobia. Phobia is an irrational fear, is called phobia. Okay, here in the phobia we are having the lot of types of the phobia, where we are having the types of the phobia. Okay, so where the examiner is asking like this: fear of the darkness, we call, yes, option is the acrophobia. Acrophobia is fear of having the height, is called acrophobia. Okay, what is the acrophobia? Acrophobia is the irrational fear of height. Okay, Irrational fear of height is called acrophobia. And what is the nyctophobia? Nyctophobia is the fear of the night, or else fear of the darkness. We call that is the nyctophobia. Okay. And what is the hydrophobia? That we will see in the patient with the as the dark boy, where the person is suffering from which disease? Yes, I think you know that one. Just comment in the comment box. Okay. So hydrophobia is the fear of water. And option D is hematophobia. Hemato means hematology, the study of the blood. Hemato means fear for the blood. We call that is a hematophobia. Fear for the water we call that is an hydrophobia. And fear for the darkness and night we call that is a yes the nyctophobia. And fear for the height we call that is an acrophobia. Very important. Okay. Our next question. Okay. 1 minute. Yes. I'm discussing the all type of the phobia here. Yes. So the answer for the question is option B here, nyctophobia. Okay. Let me discuss all type of the phobia. Phobia is an irrational fear to the yes. Phobia is an irrational fear. That is what we call the phobias. Okay. The types of phobias like this. Here, the first word is the claustrophobia. What is the cluster, students? Yes. What is the cluster? Cluster is an group or an closed space. We call that as a cluster. Okay. If the person is having fear to the closed space, okay, fear to the closed space, where we call that is a cluster phobia. Few students or the few persons, if the room door is closed, means they will get fear irrationally. Okay, because they unwanted to stay in the closed space. So because of that, the anxiety will create inside. So which leads to the irrational fear for the closed spaces. So that is what we call the claustrophobia. Here the claustrophobia we will see in the patient who will go in the yes MRI scanning. Okay, where we are putting the person inside the MRI machines. Okay, so also in the CT scanning. Okay, where we are inserting the entire body of the person for the scanning in the CT scan machine, which is in closed space. So here that point of the time, the person is feeling irrational fear, means we call that is in claustrophobia. And next word is like this, gerontophobia. Okay, what is the next word? That is the gerontophobia, fear of the aging process. We call that is in gerontophobia. Few celebrities are having this gerontophobia. Okay, because if they got age, means their beauty sense will decreases. Okay, that's what they are having the fear of the aging. So we call that is in gerontophobia. Okay, and next we are having the nosophobia or pathophobia. Patho means the disease. Okay, noso means I think you know that is the nosocomial infection we have studied. Noso means also a disease. Okay, noso or patho in the sense disease means the fear of the disease. We call that is a nosophobia. There are thousands of the phobias are there, students, but the phobias which are important for the exam purpose I am telling, and phobias which are related to the medical things. Okay, that I am trying to explain here. Very importantly, one question will come from here. Okay, nosophobia or pathophobia is the fear of the disease. Gerontophobia is the fear of the aging process. Claustrophobia is the fear of the closed space. Okay, and one more 5-star question. This is agoraphobia. What is the agoraphobia? Fear of being in the open space and away from the home. We call that is an agoraphobia. Patient is, if he is staying in the open area where there is no one is there in the surroundings, and if the patient is having the fear to be away from the home, we call that is an agoraphobia. Okay, agoraphobia is the fear of being in open spaces or away from the home. We call that is an agoraphobia. Okay. Next, what is the social phobia? Social phobia is the irrational fear to perform the activity in the presence of the others. See, I am talking very much nicely in front of the camera, okay, to deliver the class for you. If I am the person who is giving the yes, presentation in thousands of the researchers, okay, guide in the thousands of the research guides, means so I am irrationally fearing. That is okay. That is okay, because why? They are monitoring me, so I am having the internal urge inside to feel the fear. Okay, that is okay. But if simply I am having the anxiety to talk with my friends, my colleagues, my group members, means simply I am having the fears. So we call that is then social phobia. Social phobia is the irrational fear to perform the activities or irrational fear to talk in front of the others. That's what we call the social phobia. So the person is socially not developed well. So because of that, he is having the phobia of the society, we call that is a social phobia. Okay, very importantly, irrational fear to perform the activities in the presence of the others and while interacting with others, we call that is a social phobia. I think your concept is clear here. Okay, few more phobias we are having here. The xenophobia. Okay, what is the xenophobia? Xenophobia is the, yes, fear of the sex is xenophobia. What is the gamophobia? Gamophobia is the fear of the marriage. We call the gamophobia. Only little bit difference is there. Don't get difference. Don't get confused here. Xenophobia is the fear of the sex, and gamophobia is the fear of the marriage, and photophobia is the, yes, photophobia is the fear of the light. Okay, and xanthophobia is the fear of the strangers, where the usually children will get this phobia. Okay, and capnophobia is the fear of the smoke. We call that is an capnophobia, or fear of the carbon dioxide. We call that is an capnophobia. Okay, and thanatophobia, we are having the fear of the death, is the thanatophobia, and androphobia versus gynophobia. Andro means male. Okay, andro means male, and gyne means female. So irrationally you are getting fear for every female means that is what we call the gynophobia, and irrationally you are getting the fear for the, yes, the male means that is what we call the androphobia. Irrational fears towards the male is the androphobia. Irrational fears towards the female we call that is an gynophobia. Okay, and what is the algephobia? Wherever the word algia comes, that is the pain. Okay, that is the pain. For example, analgesia, here is the word algia. Okay, analgesia, algia. Okay, so where the pain is the thing that indicating the algia. Okay, if the fear for the pain is there means we call that is an algephobia, very importantly. So these all are the very important types of the phobia we have discussed here, students. One question will directly comes from here this sessions to you, like the fear to the open space is called agoraphobia. Like this they will give the body sentence with the in the scenario based. Okay, like scenario based, they will give like the patient went night away from the home in the signals at the night 1 o'clock, there is no anyone is there, but the patient uh, found surrounding no one is there, and he is getting the irrational fear. That is what we call, yes, that is what we call fear of the open space. That is what we call agoraphobia. Okay, like this scenario based they can make. So try to understand the concept and put the answer. Your answer is going to be 100% right. Okay, so that's what I'm running behind the concept rather than the questions. Okay, so here is your next questions, somewhat big questions. Read it carefully and try to answer for the question. Okay, read it carefully and try to answer for the question, students. Yes, I am waiting for your answer here. Yes, yes, let me read the question. In the process of communication, patient is telling irrelevant and unnecessary details and not coming to the point of the communication is known as, what happening here? One nursing officer and one psychiatric patient is communicating each other. Nursing officer is asking something to the patient, like for example, I'll go, nursing officer is asking the patient like what you had in the morning, what is your breakfast you had in the morning, he is asking. He is telling like that, so I went out for drinking water and I didn't find water. I went to first floor. From there I went to, yes, outside. So from there I went to bus stand, and from the bus stand I went to canteen, and from the canteen I came here. Okay, he is telling like this, but he is not coming to the point of communication, where the nursing officer asked, oh, what is your breakfast you had in the morning, but he is telling each and every irrelevant things, but he is not coming to the point of the communication. That is what we call the, yes, tangentiality. Okay, similarly one more word is there. Okay, when the nursing officer asks the patient what you had in the morning. Okay, similarly one more word like this, the patient replies like this, I went outside, I gone for the canteen and I have drink my water. Okay, so I have took breakfast. Okay, I have eaten it all the breakfast, and I have given the plate to the canteen. I have came to the ward, and in the ward, so nursing officers were there. They are loading the series like this. All things he will tell, and at the last, he will come to the point of communication. He will tell, "In the morning, I had the idli." The person is telling all the irrelevant and unnecessary things, and he is coming to the point of the communication. Means we call that is in circumstantiality. We call that is in circumstantiality, where the person going round and coming to the point of the communication. We call that as circumstantiality, and the person who is telling all irrelevant and unnecessary thing, and he is not coming to the point of the communication. That is what we call the tangentiality. Two important words you have to understand for your examination. What is circumstantiality and what is the tangentiality? Circumstantiality is the condition where the person will comes to the point of communication. Here in the questions, here they are telling not coming to the point of the communication. Okay, not coming in the sense it's tangential. He is saying all the irrelevant words and he is not coming to the point of the communication. We call that is an yes the tangentiality. Very important. The answer for this question goes to the is the tangentiality. Okay, so option C is like this clans association, and option D is like this confabulation. Let me explain these two words also. Very important words. 5-star words. Okay, 5-star words for your exam. What is the clans association? What is the confabulation? When you ask something to the patient, he will always responsive in the rhymings. Okay, he will trying to mix the words which creates the rhyming, and there is no any sense of the meaning in this that particular words like this. Okay, if you are asking something, the patient will tell to you whatever you will ask. The patient tells like this: Ravi is road Romeo, Rocky is rocket boy. Okay, roti party et. Okay, like this he will tell. The only words you want to make is the rhyming, but there is no any sense of the meaning in those words. We call that is a clans association. He is associating the clans only, not the meaning. That is what we call the clans association. Where the word, one more word is there, where the condition, where the psychiatric patient is finding and coining the new words. That is what we call neologism. What is the neologism? Neologism is the new in the sense new words. Okay, he will discover the new words and finds the new words which are in the reality there is no any meaning for that words. So like that, if the secondary person is the discovering means, that is what we call the neologism, and whatever the response the patient is giving to us is in the clans means in the rhyming means, that is what we call the clans associations. Like the classical example is he will tell that the Ravi is road Romeo, roti poti eti mati. Okay, like this in the clans eti mati poti, he will tell like this. Okay, so this is what we call the clans association. And what is the confabulation? What is the confabulation, students? So this is I have discussed in the last session also. Confabulation. Let me tell you once again. Confabulation is the simple. When the person is telling something stories, something the person is telling. Okay, the story. If he forgets something, the main important point of the theory, and he is filling that gap with the unnecessary, irrelevant things. That is what we call the confabulation. What is the confabulation? Filling the gap in the memory, we call the confabulation, students. While person or a psychiatric patient, or especially the patient in the dementia, okay, where the person in the dementia, he will tell in the dementia there is impairment in the memory is there. So because of the loss of the memory and amnesia, so the gap which created in the memory, the person trying to fill with the unnecessary irrelevant things, what that is what we call the filling the gap in the memory. That is the confabulation seen in the patient with the dementia. Okay, please write it down your important notebook and revise it once before going to the exam. This is going to be a very hot topic for your examination. Okay, so in the process of communication, patient is not telling the irrelevant and patient is telling the irrelevant unnecessary thing details and not coming to the point of the communication. Is answer goes to the tangentiality. So rest all three questions also I have discussed. What is circumstantiality, clans association, confabulation. Okay, let me go for the next question. Read the question carefully and try to answer for the question. Okay, here is the question for you all. Yes, try to answer for the question, students. Read the question carefully. A patient with depression manifests with delusion of the guilt and delusion of the nihilistic. What is known as? Yes, what is this known as? Let me clarify your question first. Patient is in the depression means patient is in the low mode. Okay, patient is in the low mode, and patient is having the two types of the delusion. Okay, which delusion? Delusion of guilt. What is the delusion of the guilt? In the delusion of the guilt, patient is having false, fixed, unshakable belief that whatever the bad thing happened to my community, my family, my friends, and my colleagues, because of me only. He is telling because of me only. He is in the deep ingredient guilt means that is in the sense of false and fixed, which is unshakable by the others. That is what we call the delusion of the guilt. What is the delusion of the guilt? Person is feel he is having the false fixed belief of he is the responsible for the whatever the bad thing happen for his community. What is that we call the, yes, the delusion of the guilt. So this is a negative symptom also. Okay, delusion of guilt is the negative symptom. Okay, so we will direct this one as in the low direction only. Okay, and what is the delusion of the nihilistic? Delusion of the nihilistic is, students, when the delusion of the nihilistic, the person is telling no one exists in the world, not even me, not even you, not even environment. No one, person is telling not even, no one exists in the world means that is the person is in the state of the nihilism. Okay, the person is in the state of the nihilism. The nihilism stands for the psychiatric person will tell you no one exists, me also don't exist, you also don't exist, and yes, the environment also don't exist, where this condition we call as the delusion of the nihilistic, where the person in the severe depression is having the delusion of the nihilistic. Very importantly, he will tell no one exists. Okay, no one exists. So delusion of the nihilistic also and negative like symptoms, so we will call this is an, we will write this is in the same direction as a, yes, same direction on the lower side. Okay, so when the disease is depression and the sign symptoms also in the negative side, what happens in the depression? Depression is mood is decreasing, and the delusion, in the delusion also the direction of the delusions are in the lower side only. So when there is the symptoms which is based on the theme of the disease, we call that is an mood congruent. Okay, so whatever the symptoms we are having that is related to the disease means we call that is, whatever the symptoms that is related to the disease we call that is an, as the mood congruent delusion. Students, we call that is a mood congruent delusion when at the same point of the time the delusions or the hallucinations is not based on the theme of the disease, we call that is an, yes, the mood incongruent delusion. Mood incongruent delusion in the sense, see, if the person, if the person of the mania is admitted and he is having the delusion of the guilt means the person of the mania is never having the delusion of the guilt, but this delusion disorder and this particular mental disorder is not related each other means they are incongruent, where the condition in which the delusional disorders, the sign symptoms not based on the theme of the disease, we call that is a mood incongruent delusions. Okay, mood incongruent delusions, where the delusions are not based on the theme of the disease, we call that is mood of mood incongruent delusions, and where the disease condition in that uh, the delusional sign symptoms which occur in that on the base of the theme of the disease, we call that is the mood congruent. Congruent ಅಂದ್ರೆ ಜೊತೆಯಲ್ಲಿ ಜೊತೆಯಲ್ಲಿ. Okay, incongruent ಅಂದ್ರೆ ಜೊತೆಯಲ್ಲಿ ಇಲ್ಲ ಅಂದಂಗೆ. Okay, simple word. Okay, and here is the somatic delusion is there, option C. So here is the, our option goes option A is the correct answer, because here the whatever the delusion of the guilt and delusion is negative symptoms, and in the depression also there is negative signs are there. So because of that the both delusional symptoms is based on the theme of the disease, we call that is mood congruent delusion. Okay, so mood incongruent, I have given the mania and the guilt of delusion of the guilt, there is the mood incongruent. Okay, I hope the concept is clear for you all. So let me go for the next option. There is the somatic delusion. What is the somatic delusion? Somatic, soma in the sense, students, the body. Okay, wherever the word soma will come, that indicates the body. What is the body of the neuron we call? Body of the neuron we call the soma. Soma indicates the body, where there is the symptoms that is related to the physical appearance. That is what we call the somatic delusion. The patient will tell like this: my brain is rotating inside, means his inside his body or on his body something is there, that is the patient's false fixed belief that is related to his body, means we call that is a somatic delusion, where the person will tell my eyes are rotating in the 360 direction and my heart is there in the my right iliac fossa and my kidney is there in my, yes, the left interthoracic space. Okay, so like this he is telling means the something he is having the false fixed belief on his own body, we call that is and the somatic delusion, students. Okay, very important. So let me read the next question. There is the conversion disorder. See, what happens in the conversion disorders, this is a very common disorder. Conversion disorders we have seen in the patient, in the not in the psychiatric patient, usually in the day to day conditions also we will see. When there the person is having some psychiatric conflict in his mind, there's unresolved questions in his mind, so that questions, that psychiatric conflict, the patient will convert into a clinical manifestation, that is in the form of the physical. If he is having the unresolved question in his mind, means he will tell the, yes, I am having the tooth pain, ear pain, back pain, like this. So where the psychiatric conflicts which are coming as a clinical manifestation in the physical forms, we call that is, he is the converting the psychiatric conflicts into the as the clinical manifestations, we call that is, and the conversion disorders, we will study all those conversion disorders in detail, students, where we will studying all the hypochondriasis and all, we will study in each and everything in detail, okay, in the next sessions. So be connected with the class and follow all the class what I am telling, students, very important class going to happen for in your exams. So whatever the options I am explaining, please write down the headings of the option, and in the down whatever the concept I am telling, just try to understand that concept, students. Examiner only can change the body of the question, he can't change the option, concept of the questions. Just try to focus on the concept if you want to clear the enhanced examination, okay. So third time I am repeating these words very carefully, okay. So after your examination, come and text in my comment box, sir, you have told the examiner is changed the body, and we have gone with the same concept what you have told, and we have got selected in the Nimhans exam. I am eagerly waiting for to hear this word, students. So let me go for the next question. Here's our next question. Okay, so look, read the questions carefully and try to answer here. Okay, read the questions carefully and try to answer it. Yes, come on, students. We are having the very last time. We are having the very broad syllabus to cover. Yes, read the question carefully and try to answer for the question. Yes, let me read the question. Okay. Question is like this: delusion disorder, where person thinks other person in deeply love with him, is known as. Okay. So let me clarify the question here. I think the question print mistake is there. Delusion disorder, where the person thinks other person. Okay. Let me change the question. Okay. Yes, the one word is extra human. That's what people are getting confused. Yes. Now read the question. Delusion disorder, where the person thinks other person in deeply love with him, is known as. Yes. Now read the question and try to answer for the question. So in the psychiatric, we are having the various types of the delusions, where the person, it may be he or it may be she is thinking that one individual, one super personality who is having the higher status, like Virat Kohli, like MS Dhoni, like our India captain Rohit Sharma, like Hardik Pandya, okay, or else for our Sunil Chetri, yes, very importantly, or else our very important Neeraj Chopra, okay, these great personality, she thinks those great personalities in love with me. So this is what the erotomania. What we call this the erotomania? If she is or he is thinking someone who is the great personality, who is having the higher socioeconomical status, is in the love with him in deeply, she used to complain repeatedly. Yes, Virat Kohli is my lover. Neeraj Chopra is my boyfriend. Like this, the patient is complaining like this repeatedly, means we call that is an erotomania. This is going to be an, yes, this is going to be a very important questions for the Nimhans students. Please note in your notebook. So, where the patient is complaining, delusion disorder, where the person thinks other person in deeply love with him, is known as. Okay. So that is what we call erotomania. The persons that she is considering as he should be or she should be with the higher status and the great personalities. Okay. So this is what we call the erotomania. And what is the delusion of the persecution? Delusion of the persecution is, what is the persecution stance in the psychiatry? The persecution, wherever the word persecution will comes, no, that is that meaning of the persecution is the, yes, there is meaning of the persecution is the doubt, students. Okay, the meaning of the persecution is the doubt. Okay, that stands for doubt. So we are having the persecutory personality. Okay, means the doubtful personality. Okay, very importantly, persecution stands for the doubt, where the delusion of the persecution here, the person is always doubtful towards the other, If the nursing officer is coming with the syringe to give the haloperidol to him, to give the lorazepam to him, okay, so at that point of the time the person complains that that nurse is coming to kill me with the knife. Okay, she is always doubtful, she's or he is always doubtful towards others. He will or she will think always all the persons are going to come near him to threat him, to harass him, okay, to rip him. So that's what in the delusion of the persecution, the person is always doubtful or suspicious towards the other. That is what we call the delusion of the persecution. In the erotomania, I have explained, and delusion of the infidelity is delusion of the infidelity stands for person is having always false fixed belief that his loved one is not in yes not faithful to him. Okay, his loved one is having the extramarital affairs. Okay, his loved one is having the unnecessary relationship with others. He is always having the false fixed belief. The person is always having the false fixed beliefs of the unfaithful with his loved one means that is what we call the delusion of the infidelity. Okay, okay, the delusion of the infidelity. Infidelity in the here stands for unfaithfulness. Okay, the his life partner is unfaithful is with him, so that is the false fixed beliefs of the person. Okay, that is unresolved one, we call that is a delusion of the infidelity. Okay, and there is one more word, the types of delusion is there, that is the delusion of the reference. Delusion of the reference, what happens in the delusion of the reference, students? In the delusion of the reference, yes, focus on me, hear me carefully and write in your notebook. Okay, so in the delusion of the reference, whatever the things happening around to him, he considered that things is happening on me only. See, I will give one classical example for you. In the morning news, the news anchor is saying in a big city where the criminal killed one lady, okay, and he went away from the city. He's telling, she's the anchor is stating like this. At the same time, the psychiatric person is watching at that anchor, and he is referring that news on himself, and he will take that anchor is talking about me only. Okay, if the two persons far away from the person is talking something about their own things, the person will see, and he will think those two persons are talking about me only. They want to talk about me only. Like this, the whatever the things happening around to the patient, if he is referring everything to himself means that is what we call, that is the false fixed beliefs of reference. That is what we call the delusion of reference. Very important, students, you have to know the difference between these all. Okay, the persecution stands for the doubtful, always the patient is doubtful towards or the suspicious towards the others, we call that the delusion of the persecution. And erotomania is the things where the he or she is in the deeply, he or she thinks that the person with the higher status or higher personality is in the deep with love with him or her. Okay, and delusion of the infidelity is the person is having the false fixed beliefs of his loved one is unfaithful with him. Okay, delusion of reference transfer, whatever things happening around to the person, he refers each and everything to himself, so we call that is the delusion of the reference. Please note in your notebook. Okay, so let me go for the next question. Here is the next question, students. Yes, here is the next question. Read the question carefully and try to answer for the question. Yes, students, read the question carefully. What is the delusion? Where exaggerated concept of one's own identity, one's own power, one's own personality, and patient feels himself as in superior is known as. Yes, try to answer for the question, students. What happening? Here is the psychiatric question is there. He feels himself as a superior. He is having the exaggerated sense of power. He will tell, I am the boss of the world. I will control the world by sitting one room. He will tell like this. And his exaggerated sense of his personality. I am the powerful man. I can break the wall of anything in the world. Like this he will tell. And the patient is also having the exaggerated sense of each and every his body. Okay. And especially he is having the he is having the sense of the superiority in all the things. Whatever the things is going in the world, he is having the sense of superiority. I will make, I am the boss, I will the control, I am the regulator of the world, I am the Pradhan Mantri of this country. He will tell like this. That is what we call, yes, that is what we call option B. That is the delusion of the grandeur. Okay, what we tell, I think we all discussed the delusion of the guilt. Okay, whatever the bad thing happening to the community, his community, he will think he is having the false belief of that bad thing is happening because of him only. So we call that is the delusion of the guilt. The person is having the false fixed belief of the guilt, means we call that is the delusion of the guilt. And the person is having the exaggerated sense of the power, personality, identity, and always the patient feels superior himself. So we call that is a delusion of the grandeur. Okay, what is the delusion of the control? Delusion of the control is that the person is having the false fixed belief that someone is controlling his mind, someone is controlling his thoughts. We call that is an, yes, the delusion of the control. Person is always complains that, and he is having the false fixed belief that whatever the things, whatever the he is doing, his mind in the control of the others. Someone is manipulating his mind, the patient will complaints, means delusion of the control is there. So someone is controlling the patient's mind, the patient is having the false fixed belief, like that we call that is a delusion of the control. Okay, so what is the delusion of the nihilistic? Delusion of the nihilistic, I explained already. In the delusion of the nihilistic, persons will say nothing is exist, not me, not you, not anyone, environment, nothing is existing. In these features we will see in the patient with the, yes, very importantly, severe depression, we call that as a delusion of the nihilism. Okay, very importantly, that is we call the delusion of nihilism. Here the person feels no one exists, not even, not me, not the environment. Okay, I hope the concept is clear for you all. Okay, let me go for the next question. Yes, the answer for the question, that is the delusion of the grandeur. Option B is the correct answer. Okay, yes, here is the next question for you all. Read the question carefully and try to answer for the question. Read the answer carefully and try to answer for the question, students. False perception of the taste without having anything in the mouth of the patient. Patient ಬಾಯಲ್ಲಿ ಏನೂ ಇಲ್ಲ, but still he is feeling the some false taste. What we call this is, yes, students, all of you know, I think, what is the illusion and what is the hallucination. Okay, hallucination is the thing where the person is having the, yes, the false perception of things in the absence of the environment. If the person is having the false perception of the thing, we call that is an hallucination. And misinterpretation in the presence of the object, the person is misinterpreting that object, we call that is an illusion, where the person is misinterpreting rope as a snake and the light as the bomb, like this the person is thinking, means, so that is what we call the illusion. Illusion is the misinterpretation. For misinterpretation, there should be a presence of the object. So he is looking over this object and he is telling that the person is having, and he is the person is this misinterpreting these things, and he is relating with the other things. Okay, that is what we call illusion. Illusion is the simple definition of the illusion is like this. It's an perception disorder where the person is misinterpreting the word or the misinterpreting the things in the presence of the object. We call that is an illusion. And hallucination is also a perception disorder where the person is, very importantly, falsely perceiving something that is actually not exist in reality. Okay, that is what we call the hallucination. Hallucination is the false perception in the absence of the object, we call that is a hallucinations. Okay, very importantly, we are having the types of the hallucinations where the person will feel the taste in the absence of the nothing, in the absence of the thing, nothing is having in the patient mouth, still he is having the false taste, or the bad perception of the taste, means we call that is then, yes, very importantly, auditory hallucination is in the absence of any object, the person is seeing something and he is telling someone is coming to me and to kill me. Okay, but actually there is no one is there. The person is seeing over the windows, he is telling someone is coming from the window to kill me. Okay, but actually when we see in the window, no one is there. Okay, that is what we call visual hallucination. Okay, that is what we call visual hallucination. Very importantly, in the auditory hallucination, and person is hearing something, okay, without any external stimuli. No one is telling to the patient, his person is telling to us like this, the god is telling to me to get discharged from the hospital, but actually god will not tell like this. Okay, so this is what the auditory hallucination, in the absence of the external stimuli, still person is hearing something, means we call that is an auditory hallucination. In the visual hallucination, person is seeing something that is actually not exist in the reality. Okay, that is the visual hallucination. And Person is getting something taste in his mouth without having anything in his mouth. That is what we call the gustatory hallucination. And the answer for the question is the yes, the gustatory hallucination. That is the false perception of taste in the without having anything in the mouth. We call that is the gustatory hallucination. Okay, visual hallucination is the person is seeing something in the absence of the object. We call that is the visual hallucination. And person is hearing something in the absence of the any voice. That is what we call auditory hallucination. Okay, and we are having the olfactory hallucination. In the olfactory hallucination, what happens? Yes, person is smelling something. Actually, there is no any smell. He is telling the rose smell is coming with me, and the mogra smell is coming, and the fog smell is coming. He will tell like this. That is what we call the olfactory hallucination. But actually, there is no any rose, no any mogra, no any fog. So, in the absence of the stimuli, the person is still telling that something smell I am getting. Okay, that is what we call the olfactory hallucination. Hallucination is something that the person is falsely percepting something which is not exactly exist in the reality. Okay, that is what we call the hallucination. Okay, so I think concept is clear for you all. Okay, one more hallucination we are having here. Okay, so that is the person will complain repeatedly crawling sensation on or under the skin. Person will complain something is running behind my skin. Okay, and someone is touching me repeatedly. Person will tell like this. What is that? The crawling sensation on or under the skin is known as what we know, what we will tell that one. Okay, option is like that. Option A is tactile hallucination. Also we call that is in formication. Okay, and option B is the hypnagogic hallucination, and option C is hypnopompic hallucination. Okay, and option D is the echophrexia. Let me answer for this question first. If the person is telling something is running behind my skin and on my body, okay, actually that is nothing. There is nothing is there on his body and under his skin, but the still person is falsely pursuing that something is touching, something is running behind my skin. Okay, something is crawling sensation is there under the skin means that is what we call the formication or the tactile hallucination. Okay, wherein option B is like this hypnagogic hallucination. Gogic, you can remember this one. Okay, gogic is go in the sense while going to the sleep or while falling in the sleep. While falling in the sleep, if the person is having the hallucination means that is what we call hypnagogic hallucination. And what is hypnopompic hallucination? Okay, hypnopompic hallucination is from arising while arising from the sleep. Okay, from arising from the sleep or from awakening from the sleep, from arising or awakening from the sleep. If the person is having the if the person is having the hallucination, we call that is the hypnopompic hallucination. While going to the sleep, that is the hypnagogic hallucination. While awakening from the sleep, that is the hypnopompic hallucination. Hypno stands for hypno means the sleep. You will studying the hypnosedative medicines. Okay, sedatives are the to sedate the patient. Hypno for the to induce the sleep in the patient. Hypno stands for the sleep. Hypnagogic stands for while going to sleep, and hypnopompic stands for while awakening from the sleep. If the person is having hallucinatory symptoms while going to sleep, that is what we call the hypnagogic hallucination, and the person is having the hallucinations while awakening from the sleep, that is what we call the hypnopompic hallucination. Very important one. Okay, and option D comes like this: echophrexia. Yes, we are having the two more important words: echophrexia and the echolalia. Okay, echophrexia and echolalia. What is the word echo? Echo means repeated. Okay, repeat. Okay, repeat. So here in our Karnataka, there is one beautiful tourist place. I think all of you know that is the Gol Gumbas. Okay, in the Bijapur city of the Karnataka, where one time we will telling something means the second time it will repeat. We call that is an wonder of the world. That is the eco wonder of the world. That is the our Gol Gumbas that is located in our Bijapur city of the Karnataka. So what is the echo? Echo in the stands for the repeat. When we tell something there one time, that the construction tells us the seven time repeatedly. That is what we call the echo of the sound, where the echo stands for the repeat and repeat. So here in the psychiatric condition, whatever the action we are doing, okay, see, I will give an example. The nursing officer is having the one vial in his hand and she is loading the medications like this. Okay. So the psychiatric person will see that one and he will mimic that one. Okay. He will mimic the action of the nurse like this. He will also simply do like this and he will do like this, like where he will loading the medications means whatever he is seeing, he is repeating, mimicking. The actions he is mimicking means we call that as an echophrexia. Similarly, in the same situation where the person is repeating the word which is heard by the others, we call that as an echolalia. Parrot like repeating the words. Okay, parrot like. Like I told Raman, come here. Patient also tells Raman, come here. I told Raman, go there. Patient also tells Raman, go there. Means whatever the patient is hearing, he is repeating, is called as that is the parrot like repetition of the word. We call that as an echolalia, and parrot repetition, or the sorry, the repetition of the action what the patient is seeing, that is what we call the echophrexia. Frexia stands for the action and lalia stands for the word. Very importantly, echo stands for the repetition. Okay, I think your concept is clear here. Let me go for the next question. Here is your next question, students. Okay, this is the last question of the day, where so all the important terminologies of the psychiatry I have explained with the good examples in the understanding and easy manner. So if you have still having any doubt, means do comment in the comment box. And the video found informative to you means please subscribe to the channel and share the content with your friends, students, and who all are the preparing for the NORCET exams. So do share with them so they can also take the benefit from this class. Okay. So if you are having any doubts, if you are having any kind of the conflicts related to a psychiatric subject, do text in the comment box. Whenever I get times, I will definitely respond to your questions. Also, we are also in the busy schedules. We are maintaining the time for, and we are giving the separate time for you all. We are also struggling a lot to help you all. So just you want to do is to hit the like button and subscribe to my channel and share with your friends. That helps me a lot, and that is the real motivation for me also. Okay, so the last question is like this: the person is showing the extreme familiarity to the unfamiliar things is known as. Okay, person is telling, see students, he is the person. Okay, he never ever seen the Taj Mahal. Okay, he never ever seen the Taj Mahal. Let me draw the Taj Mahal here. Okay, I am not a good artist, but I am trying to draw the Taj Mahal here. Okay, here is the Taj Mahal, students. Okay, he never ever seen the Taj Mahal, but when he went to see the Taj Mahal, the person will say, "I have previously seen this one." He is showing the familiarity to the unfamiliar thing. He is not so familiar with the Taj Mahal. When he see the Taj Mahal, he used to say he is familiar with him. Means the person is showing extreme familiarity to the unfamiliar things. We call that is an, yes, we call that is an deja vu. We call that is an deja vu, and where the person is unfamiliar to the familiar thing. Similarly, in the same sense, if the person is asking his best friend, "Who are you, bro?" Yes, he is the actually his best friend. After the psychiatrist, some disease incidences, he is asking his best friends, "Who are you?" Because he is unfamiliar of the familiar things. That is what we call the jamaisu. Okay, hope the concept is clear for you all. The person is showing the unfamiliarity in the familiar is called as jamaisu, and the similarly person is showing the familiarity to the unfamiliar things. We call that is the deja vu. Okay, so very important, and we are having the two more important word is the narcissism. Narcissism is the selfishness. Okay, selfishness. Very importantly, we will study the narcissistic personality disease, where the person is self-centered and gives importance to oneself, not to others, and that is what we call the narcissistic personality disorder, where the narcissism stands for the selfishness. Okay, and we are having the one more word here, the neologism. Neologism is the psychiatric persons will finds and discovers the new words which is not actually in the reality, and there is meaning for the patient but not for us. Okay, that is what we call the neologism. So this comes to the end of the sessions. If the video found informative to you all, so please do subscribe to the channel, share the content with your friends. So we'll meet in the day 2 sessions for the tomorrow 6 p.m. at the same time. So तब तक के लिए जय हिंद जय भारत. Please keep your support like this only. We will meet in the next video. Jai Hind, Jai Bharat.